Hi, I'm Dr. Gellin, and I'm one of the pediatricians at English Road Pediatrics. In this video, I will be talking to you about formula feeding. So whether you have chosen to feed your baby formula, breastfeeding didn't work the way you wanted it to, or you just need to supplement a little bit, this video will help to provide some important tips about how, when, and those type of questions that people often have when it comes to formula feeding. So the first thing I wanted to talk about is, what formula do you choose? For the vast majority of babies, the regular infant formula with iron is the right choice. There may be conditions which your pediatrician may tell you to use a different type of formula, so if you have questions about it, please talk about it with them. There are also options in terms of what kinds of formula you can buy. For instance, do you buy the powder formula? Do you buy a concentrate where you add water? Or do you buy the ready-to-feed? That really is a personal decision, although most people do use powdered formulas. And then the final question when it comes to choosing the type of formula is, do you use a certain name brand or do you use generic formula? In looking at the nutritional content of these formulas, it's perfectly fine to choose the generic formulations. They work just as well and help babies grow just as well as name brand formulas. So let's talk about how to make the formula. In general, since most people use the powder, we'll specifically talk about that. So luckily, no matter what type of formula you choose, if you're using a powder, the amount of water to powder is the same. So 2 ounces of water you use that with 1 scoop of the formula, and you mix that together. Many babies do like their formula warmed up, so really what we should do is you should make the formula first, and then you can put the whole bottle in warm water, and that can help warm up the formula. A lot of parents ask, can I use regular tap water to make the formula? And you absolutely can, especially if you are getting tap water in New York State. So we have great tap water. I would suggest it's probably even better than bottled water. If you have well water or are unsure about the source of your water, then it can be better to use either a bottled formulation or to boil the water first, and then wait and it cools down, use it to make the formula. But most of us can just use regular tap water. Other important questions about formula feeding is how much and how often. So for how much, it obviously depends on how old your baby is. Initially, your baby will probably only take 15 to 30 milliliters, which is 1/2 to 1 ounce of formula. But that goes up pretty quickly. So by about 2 weeks of age, many babies are taking 1.5 to 2 ounces. It goes up to around 4 ounces around 1 month of age. And then usually by 6 months, babies are taking between 6 to 8 ounces of formula at one time. The key is to follow your baby's cues. So if they are all scrunched up and looking around, they're still hungry. If they're all extended and relaxed in what I like to call the baby food coma, they've had enough. So follow your cues. Your pediatrician will help you follow their weight, and that will guide your decision of how much formula to give them. In terms of frequency, most babies feed every 3 to 4 hours, especially in the beginning. That does space out as they get older, and again, following their cues will guide you. So here's a few how-to tips when it comes to feeding babies, especially when babies are first born. A lot of people want to hold their baby like this and feed them. The hard part about that is many babies aren't very good at controlling their neck. And especially if your baby is having trouble with spitting up or being gassy, they may be swallowing too much air in a position like this. So what I like to recommend actually is holding your baby kind of behind their neck. So even though I'm using a plastic doll here, I have full control of this baby with my hands kind of supporting the head and the shoulders. And then I usually just sit them right down on my knee and hold them almost vertical. You can see this baby is almost vertical as I'm feeding it. And so that is a helpful position to know about. As they get older and they have better control of their neck and they don't spit up as much, they can go in different positions. But this is a great first starting position. When it comes to using the bottle itself, there are a couple tips I can remember. The first one is that when you're feeding the baby, you always want to keep milk in this formula, in this tip here. If you see air in the tip, then the baby is more likely to swallow air when they're feeding, and again can cause problems with gassiness and fussiness. So always make sure that there's formula in the tip. The other thing is, if you can see this, you'll see that even without any sucking whatsoever, that there is formula that drips out of this bottle. So that's important for a couple reasons. So you never want to do what's called bottle propping. So sometimes I'll see a baby sitting in a car seat and there's a blanket on top of them and the bottle's just kind of resting there and there's no adult actually holding the bottle. And that can be dangerous for choking because, again, as you see, this bottle is going to drip. That formula is going to keep coming out even if that baby is tired and has stopped sucking. So it can lead to kind of concerns with choking, but also concerns about overfeeding. So always make sure that you're actually holding the bottle until the baby is old enough to hold the bottle by themselves, and then it's okay to let them do that. The final thing I wanted to talk to you about are some tips that might help you with efficiency. So you do not have to make the bottle for each feed. Many parents, as they figure out how much a baby takes in a day, they make enough formula for the entire day and then just pour it off into individual bottles. That can help with the making process. If your baby is feeding from a bottle and they don't finish the entire bottle, that bottle can go in the fridge for the next hour, but really after an hour you should discard any extra formula. So I hope that this video was helpful in thinking about what types of formula to feed your baby, how often, how much, and some tips about how to actually do it. As always, with any questions, don't hesitate to contact your pediatrician. We're always happy to talk about this. Thanks so much.